It is a year after Nigeria and the African continent were certified wild polio-free by the Independent Africa Regional Certification Commission for Polio Eradication of the World Health Organization. But there is a resurgence of another type of polio, the vaccine-derived poliovirus. As at September the 6th this year, the country had no fewer than 121 cases of the vaccine-derived poliovirus. There are ongoing Oral Polio Immunisations Campaign in the different communities across the country to protect children from wild poliovirus and vaccine-derived poliovirus. Well, joining me via Zoom is Physician Cardiologist and Chairman, Nigerian National Polio Plus Committee of Rotary International, Dr. Tunji Funsho. Good morning. Thank you for joining us, Dr. Funsho.
Good morning. Thank you for having me.
Now, talk to us how much of a setback this is to the wins or the gains Nigeria had made in the first instance with regards to poliovirus.
Well, it's a setback in as much as, it is diversion resources that we could have used to further strengthening our routine immunization infrastructure and make sure that all children are covered by, all the necessary antigens to keep them healthy. It's a very expensive venture to put a lead on vaccine-derived. And that is why we are doing all we can to make sure that we have these outbreak responses, which is very, very vital to put an end to any outbreak of vaccine-derived. And Lagos was one of those states that had their own first outbreak response. We've had 7 other states in the north and 1 in the south that also did that from Saturday to yesterday, and they're going to mop up. In Lagos State, I know today and tomorrow we're still going to do mop up to make sure those children that we missed for various reasons, including being out to school or following the mothers to the market and so on, are captured in the next couple of days. So it's a setback in the sense that it's distracting us from now concentrating on building our routine immunization infrastructure and make sure that all children get all the necessary vaccines they require to be safe and grow up healthy, including the polio oral vaccine.
Right. Now, help us understand this new strain of the poliovirus, wild poliovirus and vaccine-derived polio. How severe is it in terms of it being contracted? Just talk to us what we need to know with regards to these new strains we are seeing.
First of all, how does it come about? It comes about, because the oral polio vaccine for efficacy when it was developed, it's an attenuated poliovirus. In other words, the virus has been subjected to treatment so that it doesn't cause disease, but will provoke the body to produce immunity. And it has worked, very well in the past. But, the dangers of a lot of these viruses, no matter how weak they are, if they circulate for too long in an environment, they mutate. The genetic material, changes to the point that sometimes they will cause virulent disease. It's something similar to what we were having with COVID-19, with the Delta variant and some other new variants that have evolved. Is in an effort for the virus to survive, it mutates. And how do we come about, the circulating vaccine-derived, virus? In environments where there are a large cohort of immune children, unvaccinated children, the vaccine virus can circulate, through several children over time. And during that period of time, it finds the opportunity to mutate because the virus cannot exist outside the human body for long, it will die. But when it now has, children who are good hosts, in the sense that they are not immunized, it will go in there, thrive, multiply, and with each stage of multiplication, the tendency for it to change its genetic material and become more virulent. In other words, being able to cause disease increases. And once the sanitary conditions in the environment persist, this virus is a virus that is spread through what we call the fecal-oral route. It is passed out in the feces, it goes into the environment, it festers there for a while, and before it dies out, another child ingests it, goes through the same process. So as long as the environment remains unsanitary, as long as these children have no access to clean drinking water, then the risk increases. And the risk is compounded by the fact that the routine immunization coverage is very low. In most parts, on the average in the country, it's just about 50%. Some parts have less than 20%. So when you have low routine immunization coverage, you have large, cohorts of children unimmunized, and you have unsanitary environment where children, get, their food contaminated by water that's infected with the, vaccine, polio virus. Then the risks of them, getting this disease is high.
What is the level of severity of this virus, and what are the symptoms parents should look out for?
It doesn't differ in any way, from the symptom complex of the polio, wild polio virus, in the sense that it will cause fever in a child. The child may go off their food and stuff like that, and in 1 out of 200 cases, the child may suffer the loss of a limb or two as a consequence of the infection. But the symptoms are non-specific until the paralysis shows itself in the child.
Now there are talks that we have about 121 cases on the ground as we speak. What plans are there to contain this number and ensure that there is no spread?
Well, but the outbreak responses we are mounting. In order to control such outbreaks, you need to go out and immunize every child below the age of 5 to cover them. Whether they have been immunized before or not, it's an additional protection. The other new thing we've introduced is to introduce a new and more stable oral polio vaccine, which has a much less tendency to mutation and causing disease. So usually within 6 months, if we mount a good quality outbreak response, we cover, a large proportion, of the children, and we do at least 2 of these about a month apart. Lagos has just done its first one. There are states that are doing their second outbreak response. Usually that is sufficient to break that transmission, and the numbers will go down and virtually disappear. We've succeeded doing that in countries like, India, Philippines, and I think Senegal.
And as we speak, are we getting that kind of response that we can term good quality from states' governments across the states?
It's mixed. Some states, are very much, up and about doing it. Other states are not, as much involved in it as we would wish. Because this takes a lot of resources. Lagos State, for instance, has to send out about 9,000 teams, and each team of vaccinators comprises at least 3, personnel. So you can, add up that number and add up their transportation, add up their allowances they require, add up the resources that's required to keep the cold chain. So it's a major undertaking, and without funds, they will not work. And so we are pleading with the state governments, to rise up to the occasion and bridge those gaps that they will have discovered, during this response we've had. The government always has a feedback because they're actually in the driving seat, of this campaign.
What concerns do you have with regards to, we already are dealing with, state governments are dealing with the COVID-19 pandemic, and now this? What concerns do you see? What challenges do you foresee?
Well, the COVID-19 itself is part of the reason, why we've had these outbreaks, because for about 6 number one, routine immunization, went down because all resources were diverted, towards and the same, staff towards COVID-19 containment. Parents were not able to access primary healthcare centers, again, because of the risk, of transmission of COVID-19. So these two factors, led to a large number of, newborn children not having access to the vaccination. But now that we have resumed, I believe that we'll be able to put a lead on it. The quality of the immunization is also hampered, like I said, to funding. We've had issues in the field where vaccinators didn't turn up because, they're very meager stipends that they're expected to be paid for the last round they've done were not paid in some states. So we're engaging the Nigerian Governors Forum to assist us to ensuring that, the state governments rise up to the occasion just to make sure that we don't continue to prolong the outbreak of vaccine-derived.
And where they do not rise up to the occasion to get that good quality response, what are the implications that we might have as a country?
Well, the implications is that, more children will be paralyzed as a result of vaccine-derived poliovirus, which is, totally unnecessary, because it will prolong, how long the virus stays in the environment. As I said earlier, if we do it right, if we have, well-organized, high-quality outbreak responses, usually we're able to put a lead on this kind of outbreak within 6 months.
All right. We'll leave the conversation here now. Thank you so much, Dr. Tunji Funsho, Physician Cardiologist and Chairman, Nigeria National Polio Plus Committee on Rotary International, Dr. Tunji Funsho. Thank you so much for your time.
Thank you very much for having me.